So hi, I'm Dr. Vipul Rastogi. I'm a consultant psychiatrist at Medanta Hospital, Gurgaon. You want more?
Sir, now let's talk about PTSD. Can you give me an
Yes.
understanding of PTSD and how you can identify it? I think, what do you
Okay.
think PTSD is?
Oh, so PTSD is a relatively new disease. It only came in, people started talking about it from mid 90s. So after the first Gulf War, so after Iraq had invaded Kuwait, the U.S. troops went to help, and when they came back, they presented with symptoms of anxiety, hypervigilance, poor sleep, bad dreams, nightmares, irritability, avoidance behaviors, and then people started talking about post-traumatic stress disorder. So the idea was these soldiers saw very many things which were life-threatening to their own life or to other people. And it does not just exist, we don't just talk about life-threatening events, but life-changing events also. And so those experiences translate into PTSD for some people. Not everybody exposed to difficult times will develop PTSD. But quite a few people do develop PTSD. More and more known now. We're talking about it quite a lot. Very much treatable, very treatable disease. As I said, it's incredibly common.
Is PTSD like same as trauma or is it different?
So yeah, so it's a response to a trauma. So people who've had traumatic experiences in whatever form, it could be uh, getting stuck in a lift, or it could be having a big loss in a share market, or it could be an assault, or it could be seeing somebody getting assaulted. All of them can translate into post-traumatic stress disorder. So the body does not respond very kindly to these traumatic experiences and starts developing a form of anxiety. So PTSD is a type of anxiety disorder. So
Uh, what can cause PTSD? Like commonly, what causes PTSD?
So again, the traumatic experiences are the key point. So a person to have a diagnosis of PTSD, the exposure to trauma should have been within the previous 6 months. So we will not call it PTSD if people are remembering events that happened 5 years ago. So we won't call it PTSD. But if something has happened, and it's a very much a straight correlation. So this has happened, and this has translated into the symptoms that people are experiencing now. So, and as I said, it could be a very small thing because if you look at stress, so stress is very personal and very subjective. So for me and you, whatever happened might be not traumatic or might not be relevant, but for the person who has the PTSD, that small event for us might be something big or huge for them. So it is a very subjective phenomena, the stress, the trauma that people go through.
So do you mind listing some symptoms of PTSD?
Yeah. So one of the core symptoms of PTSD is people having flashbacks and nightmares. So reliving the experience over and over again. People are hyper vigilant. They're trying to avoid that kind of circumstance. So let's say somebody was exposed to a bomb blast, right? And so next time, so they're very vigilant about avoiding loud noises. So they don't want to be in places where people would expect loud noises. Uh, so along with that, there'll be a lot of physical symptoms of anxiety, racing heartbeat, sweaty, dry mouth, shortness of breath, maybe tremors in hand, poor sleep, uh, irritability, as I said, avoiding situations and people where they might be able to recollect or relive the trauma. Those are all standard symptoms of PTSD.
What should one do if he starts seeing these symptoms in his life? Who should he consult? Where should he go?
So it's important to consult someone. So generally speaking, there's a lot of stigma in going to a psychiatrist. So people can start with a psychologist. They could start with a psychiatrist, of course. They could even go to a general physician, but start somewhere. If the general physician doesn't feel able to look after it, then of course they are going to suggest to you go to a psychologist or a psychiatrist. But generally speaking, you can straight away go to a psychologist or a psychiatrist. The the current events that we are seeing, if we talk about PTSD, is people who got exposed, students who got exposed to the Ukraine and Russia war. So a lot of children who are in, or students who are in Kharkiv, and they had to basically run away for their lives, and they heard a lot of bomb blasts. So a lot of these students are experiencing PTSD at the present moment.
Sir, like you said before, that PTSD is a new concept that just started. So was it not there before, or have people started developing it now with the generation change?
No, so we did not use this diagnosis. Could have called it adjustment disorder or anxiety disorder. But
So
the
that's
term
the
stuck.
time when we thought that trauma and PTSD are the same thing.
Well, trauma and PTSD, PTSD and trauma are two different things. PTSD is a
Different.
response to a
Right.
trauma. Yes. So people just did not use this term, or did not, use this diagnosis that much. But now it is in popular culture, or in popular speak, or a popular diagnosis that we make. We never did that. Did this before.
So you said that PTSD is curable. So what are the treatments and how long does it take to completely heal PTSD?
Yeah. So everybody is different. So everybody will have their own path in recovery. Generally speaking, a good combination of psychological support, so which means counseling, psychotherapy, along with medication and lifestyle changes, are the treatment for PTSD. When we talk about lifestyle changes, we're talking about having a routine with some exercise or hobbies on a daily basis, having a good in a way job, employment, or education, so that the mind is diverted. That's number one. Psychotherapy, generally speaking, cognitive behavioral therapy is what is recommended. Or there's another one called EMDR. There's a two usual or trauma focused therapy. There are three, four types of therapies that are used. And of course, then the medications are there. A combination of all the three together is the best approach.
Sir, have you come across any patients that have gone through PTSD, and can you tell us how gravely it's affected their lives? Does it affect their relationships, their daily life routine? What happens?
Yeah, so look, so if I just talk to you about a patient who was in Kharkiv, so he's still not reached home. He's still, because he feels that if he comes back home, then he will not have a way to get back out, right? The visas and whatever support he can get. So he's in a different country now, but he he doesn't like talking to his family also these days. So there's a lot of irritability in him. There's a lot of anguish. Of course, the mood is not the best. A lot of irritability. If he closes his eyes, he sees flashbacks. So the gunfights or the sound of the guns going off, bomb blasts. So all those things, he's recollecting it. He's getting better as time progresses, because it's now been good 4 months since he left Ukraine. But it was a big ordeal, and according to him, he saw people, dead people on the road, and and you heard all the bad stories. uh, didn't have food or warm clothes or shelter. So still struggling. And I'm just telling you about one person, but there were more than 10,000 students perhaps in Ukraine. So, and people go through traumas all the time. So car accidents, and somebody dies in the car accident, for example, or you're full of guilt, whether they were themselves driving, uh, victims of robbery, rape. The list is a long list, as I said to you. I mean, we're talking about, these are very difficult things to hear, but a small thing also might affect people, because as I said, it's very subjective and personal.
So sir, can PTSD also result in other mental health issues like?
Yeah. So people with PTSD generally have some form of depression. So that goes hand in hand. A lot of people may also develop self-harm or suicidal thoughts, suicidality. Uh, look, insomnia is part and parcel of it. So you can't sleep very well. The appetite disturbance, that also goes with it. Uh, so yeah, and a lot of people take to alcohol or smoking or drugs to cope with their symptoms. So again, so that's a different gambit of illnesses, but they all stem from the same fact that person has been through difficult times and they don't know how to manage those thoughts and emotions that go with it.
So what are the types of PTSD, and which is the most common type?
I mean, look, you can have a simple or complex, but we generally don't talk about types of PTSD. Um, you have to think of it like one illness. And with anything, right? Whether it's depression or anxiety, you can have, some people have milder symptoms, some have moderate, some have severe symptoms. But the general principles are the same.
Mr. Rastogi, the patient you talked about before, you said that it's been 4 months, so with time it's getting better. Is that how PTSD is healed with time, or
Yeah,
if not?
with time it will become better. But some people might just get better spontaneously. Some good
Right.
things happen in their life. They get the right support. They reach supported environment, and they might recover by themselves. Not everybody would come forward to seek help. Some people may not need help.
But if
But
not, if they don't look for help, then is there a chance that it could get worse?
yes, because look, if you're irritable, your social functioning will get disrupted, whether it's with your personal relations or work relationships, right? If you can't study, your academics are going to suffer. So it affects in totality. There is no doubt about that. But unfortunately, the system works on the person coming forward to seek help. Nobody can go to you, and provide help. So yeah, so it's up to the person to come forward. But family members are generally the instigators who suggest that please seek help. But psychiatry, psychology still has a lot of stigma, and not everybody will want to come forward to seek help. But seeking help will only make it better, not worse.
So do factors like social media affect the PTSD figures? If so, how much?
I can't give you a figure. Said I, there's generally no figure that we can
No?
give to you. Uh, I don't think I can.
All right, no problem, sir.
But can you say it's common now?
It is common. It is
Very
common.
common.
So I won't say very common. I would say common. So I might be making a diagnosis of PTSD in 15, 20 people a month. So new people, so 2, 3 people a week, that sort of a thing. And I have a practice of about 500 people a month. So that sort of.
Sir, what about the? Sorry, you go ahead, Parik.
So like, can PTSD cause like a certain feeling of detachment from like people, or like just feeling unattached or like distant from people when you get PTSD?
Yes, because when you're anxious, one, you're irritable, so you don't want to be around people. Uh, Second, you feel very vulnerable, and you may not want to be in touch with people. So generally, people start isolating themselves when they're having a hard time. So whether it is PTSD or depression, people will go into a shell. So the relationships are going to suffer, whether by choice or as the nature of the illness is, that you would normally cut off from people.
Sir, sorry, last question. Sir,
Go
what
ahead.
do you think the war in Ukraine, what effect do you think it has had on the adolescents there? And are they likely to suffer from PTSD? Because war is, well, a main reason why people suffer from PTSD.
Absolutely. I mean, look, they're already suffering from PTSD. So I mean, that's a fact. And so we can't really speak about people in Ukraine, but they would all obviously going to have that. The whole generation is going to have PTSD. So residents of every place where the bombings happened, all of them are going to have. But the students who felt they were not in control they didn't know what to do, where the food is going to come. There was rioting, shooting. So they are all going to suffer. Not all, but quite a lot.
Got it, sir.
Thank you
Thank
very
you so
much.
much.
Thank you.
Thank you,
All the
doctor.
very
Thank
best
you
with
for
your
your
question.
time.
Thank you.
Thank you
Apologies
so
for
much,
being
sir.
late.
Thank you, sir.
Thank you.
No, sir, no problem.
Bye.
Bye, sir.
Bye.
Bye bye.
Acha, okay, I have no idea if this got recorded. Just let me
It
check.
did. It shows recording.
Are
the
you sure?
symbol. Yes,
Yeah,
it
it's
does.
still recording.
Switch
It's
off the
still
recording.
recording.
ठीक है.
Switch off the recording. It's still recording.